Hello all, we are DiscOva, a comfortable and convenient method to collect, store, and transport menstrual effluent samples while maintaining the integrity for these samples to be useful. This will establish us as the gold standard in menstrual effluent diagnostics. We are asking for $250,000 to fund the first stages of our go-to-market strategy. This involves demonstrating the technical feasibility for our product and funding the first few iterations of the product's design. This is Christine, a 23-year-old investment banker living in bustling New York. She's always busy, but her painful periods get in the way of her lifestyle. For a week every month, she is subjected to intense pain. This affects her ability to work and enjoy her life. Her doctor is unable to get a clear diagnosis of her condition because she does not have the time or ability to get invasive surgery. The issues that Christine face more than 1 in 10 women in the United States. The importance of an early diagnosis for women who suffer at a physical, emotional, and social level due to undiagnosed endometriosis cannot be understated. In addition, the condition costs the healthcare industry billions every year. At DiscOva, we want to reimagine gynecologic healthcare, and we believe that the key to it is menstrual effluent. Far from a waste product or something to be ashamed of, we see menstrual effluent as the key to a new generation of gynecologic diagnostics. Beyond its technical potential, menstrual effluent is secreted safely every month. So instead of invasive gynecologic exams, the sample can be collected from the comfort of one's own home. Despite its promise, menstrual effluent is hard to use because unlike blood or urine, there exists no standard method of collection. DiscOva will address the design challenges in collecting and preserving the sample during transport, thus enabling it to reach its full diagnostic potential while embedding ourselves in the clinical pathway. For conditions like endometriosis, as soon as these biomarkers become validated, we can immediately become translatable and start saving lives. Our total addressable market is based on this beachhead population, which is the suspected incidence of endometriosis. We assume that patients with more severe symptoms will be a more serviceable market for an endometriosis test, and we estimate a 10% market capture. DiscOva is a multifaceted solution that will collect and safely transport the sample where it can be assayed and used. Looking at the research, we're told that there is a need for something similar to a menstrual cup, but tailored to the need of collection rather than disposal. Our technical superiority over our competitors establishes us as the best method to collect menstrual effluent for diagnostic purposes. Our competitors are NextGen Jane and Quinn, who focus on extraction from tampons and dried blood spot testing from pads. Our preservation of live cells enables diagnoses of previously thought undiagnosable diseases without surgery, while boasting a higher signal-to-noise ratio for their established biomarkers. We envision 2 business models. At the time of our entry to market, we imagine a model very similar to Cologuard, where DiscOva is used as a one-time test. However, our vision for the future is something where users can pick and choose their needs and get a tailored subscription. Here's some of the steps we've taken to advance DiscOva thus far. We've performed a comprehensive review of the research into the diagnostic potential of menstrual effluent. This is identifying all of the promising biomarkers in existing research. We've also established what the methods to preserve these cells are, and also established what other markers can be preserved with them. We've performed extensive customer discovery to address one of the major barriers to entry: user stigma. One of our advisors, David Stein, who has worked in blood diagnostics, said that while many people have tried to use menstrual effluent as a diagnostic, the stigma against handling menstrual products makes things difficult. This insight, as well as our interviews, has guided our design to make something that is not only technically viable, but also something that people would use to have a real impact on their lives. By the end of the academic year, we plan to have our design completed and begin benchtop testing. This is a brief overview of our team and advisors, all very experienced in this realm. Thank you all so much.